Nipple discharge. Let's understand the causes of nipple discharge. It can be because of discharge from surface. Discharge from surface could be due to Pickett's disease, or it could be because of some skin disease like eczema, psoriasis, or it could be sometimes due to rare causes like chancre. Now, discharge from single duct. Now, what if it is a blood stained discharge? It could be because of intraductal papilloma, intraductal carcinoma, could be because of duct ectasia. Now, what if it is a serous discharge? A serous discharge could be because of fibrocystic disease, or it could be a physiological cause, or it could be duct ectasia, and very rarely a carcinoma. Now, what if the discharge is from the multiple ducts? From multiple duct, it could be blood stain. So here the important cause first would be carcinoma, then it could be because of ectasia, it could be because of fibrocystic disease. Then what if it is a green colored discharge? If it is a green colored discharge or a black colored discharge, then it is going to be because of duct ectasia. What if it is a purulent discharge? A purulent discharge is going to be because of infection. What if it is a serous discharge? A serous discharge is going to be because of fibrocystic disease, duct ectasia, or it could be again due to carcinoma. Then if the discharge is milky, then it could be because of lactation, and the mother might be lactating, or it could be because of any pituitary function or thyroid disturbance. Pituitary disorder or thyroid disorder. So if a patient of a nipple discharge comes to you, first step is to ascertain whether the discharge is from the surface, or discharge is from a single duct, or discharge is from multiple ducts, because depending upon it you would think of the causes. As if it is a discharge from a single duct and it is a blood stain, intraductal papilloma is more common than carcinoma. Now if it is a blood stain discharge from multiple ducts, in that case intraductal carcinoma is a more important cause. So how do we manage such patients, right? So the patient presents, you assess, you take the history, then you go for your investigation. As we said, there has to be a triple assessment, right? So the first step would be the history and the clinical examination, followed by investigation, right? So investigation would include over here mammography or a USG. Now the third step, which I said, was a histopathological examination. Well, that would be need to be done if there is some abnormal findings in the imaging technique, like presence of a tumor. In that case it would require a biopsy, else it would not be requiring a biopsy. So now if investigations are abnormal, what do you mean by abnormal? Like, do investigations for mass lesion, like over here we would need to proceed with the true cut biopsy. Now if the investigations are normal, then we need to ascertain, as we had done in our history and clinical examination, that it is a single duct discharge, or it is a multiple duct discharge. So now in single duct discharge we see what, whether the breastfeeding is an issue or not. If it is not an issue, then what do we go? We go for a microdocectomy, right? So what is this microdocectomy? So basically, let's consider this to be the nipple and here, and this to be the duct. So it has to be a tennis racket shaped incision, right? So I'm bad with the diagram, so sorry for that. A tennis racket incision, right? So in microdocectomy it is a tennis racket incision. Now if the breastfeeding is an issue, right, then we need to consider a ductoscopy or a ductography, and then go for a localized duct excision, right? Now if the origin of duct is not certain, then in those cases we do an operation which is called Hadfield operation, right? So what happens over here is, so let's make the diagram again. So over here we have this, right? So you have your breast lobule, so it is going to be a conical shaped lesion, right? Conical shaped excision, right? So it will be a subareolar incision. So in this case you need to do a Hadfield operation. Now over here, if it is a multiple duct discharge, now if there is no distressing symptoms, then we could just give a reassurance and follow up the patient. Whereas if there are distressing symptoms, then we need to do a total duct excision. So let's revise the nipple discharge. First thing is to know the causes. It is discharge from surface, Piggish disease, discharge from single duct. If it is blood stain, the most important cause is intraductal papilloma. If it is serous, it would be fibrocystic disease. Now if it is discharge from multiple duct, in blood stain it is carcinoma. If it is a green color or black discharge, it is duct ectasia. If it is purulent, it is infection. It is serous, fibrocystic disease. In case of milk, it is because of a lactating mother. Now we discussed the treatment part, where investigations would be radiological, mammography or ultrasound. If it is abnormal, we will go for the mass lesion. That would be the next step, would be doing a biopsy. If they're normal, then we see multiple duct discharge or single duct discharge. If there's a single duct discharge, we will go for a localized, we'll go for the microdocectomy, which is a tennis racket incision and removing the pathological duct. If the breastfeeding an issue, then we might need to consider ductoscopy or a ductography. Now in case of multiple duct discharge, if there are distressing symptoms, we will go for total duct excision. In case of single duct discharge, if the origin of duct is not certain, then we do a Hadfield operation, which is the subareolar incision, where we make a cone shaped incision and remove the ducts.